If meconium was present in the amniotic fluid, the person delivering the baby should have suctioned the oropharynx and nares before delivering the shoulders.
There we go.
There we go.
Yeah.
Okay, 43.
A baby's skin color changing from blue to pink in the first several seconds following delivery can provide the most rapid and visible indicator of adequate breathing and circulation. The baby's skin color is best determined by looking at the central part of the body. A shoulder roll may be placed to help maintain extension. The neck is slightly extended and the head placed in neutral position. Free flow oxygen should be given with oxygen tubing directed at the face of a spontaneously breathing infant or with a cupped hand around the nose and mouth to increase the concentration of oxygen.
There you go. Keep on going. There. Success.
Now, what if this 32 weeks?
Stimulation can be provided by gentle flicking or slapping of the sole of the foot. Stimulation also can be provided by gentle rubbing of the infant's back.
I didn't touch it. Good heart rate. Put it on the table. Where the next project. Still has a good heart rate.
With the flow inflating bag, free flow oxygen can be given by positioning the bag loosely over the nose and mouth.
Okay, that's 1 minute.
Keep it on the face.
Here we go, 1 minute.
Respiration's maybe something. There we go. Color's not bad, but it's not.
The heart rate's good. It's fine. Nothing else?
Beautiful.
That's picking up.
Good. Keep showing that.
Sorry, Larry. Keep tapping for you.
Advantages of the self-inflating bag. Will always refill after being squeezed, even with no compressed gas source. Pressure release valve makes overinflation less likely. Disadvantages of the self-inflating bag. Will inflate even if there is not a seal between the mask and the patient's face. Requires a reservoir attachment to deliver close to 100% oxygen. Cannot be used to deliver 100% free flow oxygen reliably. The parts of the self-inflating bag include the pressure manometer attachment site, the oxygen reservoir, the oxygen inlet, the air inlet, which allows mixing of air and oxygen, the patient outlet, where different types of masks can be attached, the valve assembly, which assures consistent flow of gas, the pressure release or pop-off valve, which limits the delivered pressures. When the bag is squeezed, the valve opens, releasing oxygen or air to the baby. When the bag reinflates, the valve is closed, preventing the infant's exhaled breath from entering the bag and being rebreathed. A self-inflating bag cannot deliver high concentrations of oxygen without an oxygen reservoir. Each time the bag reinflates after it is squeezed, Air is drawn into the bag through the air inlet. The air dilutes the concentration of oxygen in the bag. A self-inflating bag can deliver high concentrations of oxygen only by using an oxygen reservoir. The oxygen reservoir is placed over the bag's air inlet, allowing 100% oxygen to collect and preventing the oxygen from being diluted with room air. The flow of oxygen is delivered reliably to the patient only when the bag is being squeezed. Free flow 100% oxygen cannot be given reliably by self-inflating bag. The bag must be squeezed for reliable 90 to 100% oxygen delivery. When using the flow inflating bag, a good seal of the mask on the face is vital for the bag to fill properly. Advantages of the flow inflating bag: delivers 100% oxygen at all times. Easy to determine when there is a seal on the patient's face. Stiffness of the lungs can be felt. Can be used to deliver free flow 100% oxygen. Disadvantages: requires a tight seal between the mask and the patient to remain inflated. Requires a gas source to inflate. Usually does not have a safety pop-off valve. Parts of the flow inflating bag: the flow control valve, which controls bag inflation. The oxygen inlet, where oxygen enters the bag. The pressure manometer attachment site. The patient outlet, to which may be attached different sizes and types of masks. Flow inflating bags often have a site for attaching a pressure manometer. The pressure manometer alerts you to the amount of pressure you are using to ventilate the newborn. A flow inflating bag inflates with a source of compressed gas such as oxygen. Once the oxygen enters the bag, it is not diluted. Therefore, the same concentration of oxygen that enters the bag is delivered to the patient. The flow of oxygen to the infant is controlled by adjusting the flow meter and the flow control valve. A flow inflating bag and mask can be used to deliver free flow oxygen. The mask should be loosely placed on the face, allowing some gas to escape around the edges and preventing high pressure from being transmitted to the newborn's lungs. Although this lesson describes placing the tip of the blade in the vallecula, some prefer to place it directly on the epiglottis, gently compressing it against the base of the tongue to allow visualization of the airway. Poor visualization of the airway may be improved by elevation of the tongue with the laryngoscope. If the larynx is difficult to visualize, external cricoid pressure may help bring it into view. If the tube is inserted too far, it will pass into the right mainstem bronchus. Signs of right mainstem intubation include breath sounds heard over the right lung but not the left, or louder breath sounds on the right side than the left. The baby's heart rate and color may not improve.
The stylet is used to stiffen the endotracheal tube and facilitate intubation. It must not protrude from the end of the endotracheal tube.
Detection of the presence of CO2 can confirm placement of the endotracheal tube in the trachea rather than the esophagus. The CO2 detector is placed between the endotracheal tube and the ventilation bag. A color change signifies the presence of CO2 and correct positioning of the endotracheal tube. The color change shown here, from purple to yellow, signifies positive CO2 detection. With coordinated CPR, the person performing compression should count aloud to synchronize the compressions and ventilations. 1 and 2 and 3 and breathe. 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 1 and Administer free-flow oxygen throughout the suctioning procedure. Insert a laryngoscope and use a 12 or 14 French suction catheter to clear the mouth and posterior pharynx. Insert an endotracheal tube into the trachea and attach it to a suction source. Apply suction as the tube is slowly withdrawn. Repeat as necessary until little additional meconium is recovered or until the baby's heart rate indicates that resuscitation must proceed without delay. Here the process is shown diagrammatically.